Hi friends. So today we'll be doing up a very important topic from which definitely one question in your profs will be there. And this is important for your understanding also. And this is important for the basics of microbiology. So I'm talking about the growth curve. Definitely a short note or a exactly not the exactly long note doesn't come on it. Mostly the short note and all. But the basic understanding as per the profs also and for the PG exam is important of the growth curve. A growth curve in the simplest way, I will tell you guys. And in this, obviously, you must have done in your colleges also. Four phases are there. One is lag. Okay. One phase is what, guys? Lag. One is log. Fine. So I suppose you can see properly. One is lag and one is log. One is stationary. One is stationary. Okay. And one is decline. One is decline phase. So in total, you need to remember that there are four phases. One is lag, one is log, one is stationary, and one is decline of any of the bacteria which is inoculated into a liquid culture media. Okay, so that particular one have to go for these particular steps: lag, log, stationary, decline. Is it fine? So if we talk about the lag phase first, lag phase first. So in this lag phase, guys, now you're in second year, you have to think of your first year. When you have come for the first time in the medical college and you are not a day scholar, you are away from the like that particular town of yours, hometown is at a distance from the medical college. So basically, you reside in the hostel. So when you come in the first year into the hostel, what happens? Firstly, you are a bit depressed that you are from away from the home, and you will try to adapt to those particular conditions. Okay. So the crux of the things is the bacteria, when inoculated into liquid culture media, firstly adapts to the condition. Okay, what it does do? It adapts to these conditions which you have provided. Okay, so you are away from the home, you adapt to those by building up what? Like you will inculcate everything. Okay, you will build up enzymes, metabolites, because new books you start having at of the anatomy, physiology, and biochemistry. So you will have all the warfare of yours for the exam and all. So what is being done in the lag phase? Build up of the enzymes and metabolites. Is it okay? And you will agree also with me the way I'm telling up. Besides this, when you are away from the home, you will be a bit depressed also. Yes or no? In the starting, if you are not gone for any coaching distance, this is the first time you are going away from the home. So obviously, you will be slight bit depressed also. So that particular depression of yours, okay, will manifest in the form of what? Overeating. Okay, and when you will overeat, you will increase in size. So this particular example is there to tell you that the bacteria increase in size in the lag phase. I suppose it's clear, pretty clear. You build up for your future. Okay, in what sort you build up? You take up new books, you take up new apps like of top tutorials, MBBS curriculum app. If you take right from the first year, then all the things are sorted as per the NMC curriculum of yours. So that will be very good of yours. So basically that's what is there, the buildup of enzymes and metabolites in the first year. And here the bacteria does what? Build up these enzymes and metabolites, adapt to the conditions of the liquid culture media and increase in size. Number does not increase in the lag phase. This is what is the question they ask in the exam. Then comes the log phase, guys. Then comes what? Then comes the log phase. Log phase you can compare up with what? The second year. And second year is what? Termed as the honeymoon prof. Now you are well adapted to everybody, to the conditions also, to your friends also. So to everything you are well adapted. So what will happen? your activities will be increasing up like anything. Okay. And there is a exponential increase in numbers to the power n. Okay. To the power n, exponential increase you will have in which particular phase, guys? Log phase. So the exponential increase in numbers is there. Okay. And the examiner will try to dodge you by asking up the number increase, but what is not increased? Growth rate. Okay. Number increase, but what is not increased? Growth rate. So to the power n, exponential increase is there in the numbers. The bacteria will be maximum active as you are there in the MBBS, maximum active in the second year. So bacteria will also be the maximum active in the second year. That is the log phase. Okay, so maximum active, and this is the ideal phase in which this particular one will be uniformly stained. So if you are telling somebody that which is the best phase for the gram staining, the answer is log phase. And why is it so? Because in this, the bacteria is uniformly stained. Okay. So this is the best phase. Best phase for what, guys? It is the best phase for gram staining. It is the best phase for what? It is the best phase for gram staining. Okay. So this also needs to be remembered. Growth number increase, but the growth rate is constant. And that growth rate constant is how much? To the power n. Okay. Now, as life goes on, the second year will also go. You don't want to be in the second year only in the MBBS. So now you get out of the MBBS phase. Okay. Now focus on the bacteria life only. Now the third thing which comes up is what, guys? The stationary phase. Okay. Now what have come? The stationary phase. And what happens in the stationary phase? In the stationary phase, live is equal to dead. Means the bacteria which are dying off and the bacteria which are coming out. Means the viable count as such remains constant. Okay. So live is equal to dead bacilli. That is what is there in the stationary phase. Live is equal to dead bacilli, and the viable count means what, guys? Viable count means the living one. The viable count will be constant. Okay, viable count will be constant. It will not be increasing up because equally number of bacteria they are dying. So viable count is constant. Okay, and this particular in others way, if you want to remember, the viable count is constant, but the total bacterial count will increase. Okay, means the dead bacteria and the viable count, viable and non-viable, you will mix up enough to total count. But total count as such increase, but the viable count remains constant. Okay, then this is the phase, stationary phase, in which S for S happens. That is known as sporulation. Okay. So frequently asked question of the NEET PG also this one, that the sporulation of the bacteria happens in which phase? The answer is the sporulation of the bacteria happens in the stationary phase. And remember S for S. Okay. Now you can ask, sir, how sporulation will happen in stationary phase? Because if you remember, the next phase is what, guys? Decline phase, the dead phase. If the bacteria have to survive this death phase, now it have to survive its, because it is sensing up that the next phase is coming what? Final phase, death phase. To survive the decline phase, the bacteria in the stationary phase only starts producing what? The spores. Okay. So this is what is the logic that why the stationary phase they produce the spores. Fine. Interestingly, the exotoxin production, which is mainly by the gram-positive bacteria, it also happens in the stationary phase. Okay. Another important point that when we use the bacteria for the commercial purpose. And what is being produced from that? Antibiotics. Okay. So antibiotics production, that also ought to happen in the stationary phase. Antibiotics production also ought to happen in which phase, guys? Stationary phase. Okay. And for your added information, that in the stationary phase, one more thing they secrete up, and that one more thing is what? Bacteriocins. Okay. So bacteriocin production is also observed in which particular phase, guys? Stationary phase. Okay. So you can remember up antibiotics, bacteriocin, and exotoxin production. Okay. They all happen in which phase of the bacterial growth curve? The answer is stationary phase. Now, at your level, you must not be knowing of what is bacteriocins. So, bacteriocins are those particular substances which are secreted by the bacteria for their own growth, okay, and to inhibit others. Means these particular things are what? These particular things are sort of a selfish thing. Selfish thing in what sort? That my growth is promoted, all others are inhibited. That is what is termed as bacteriocin. So in the stationary phase, live is equal to dead, the viable count constant, but the total bacterial count is found to be increased. Okay, sporulation happens in this particular phase, and you need to remember these three alphabets abe. And what is there in abe? That antibiotics are produced, bacteriocin is produced, and exotoxin production is there in the stationary phase. Now coming to the decline phase, guys. Now coming to what? Now coming to the decline phase. And what is decline phase? There is a complete accumulation. Okay. Complete accumulation of what? Toxic metabolites. If I say this in Hindi, sort of I will tell you in English also that thing. Complete accumulation of toxic metabolite means what, guys? कि जब उस बैक्टीरिया के पाप का घड़ा भर जाए, means that particular fellow have done so much of sins that now it is the end time for that fellow. That is what is the complete accumulation. So there is the complete accumulation of what? Toxic metabolites. Okay. And because of the complete accumulation of toxic metabolites, they start dying. Okay. They start dying. And obviously here the viable count decrease. And it can be zero also because there's a decline phase. Involution forms. Involution forms are what, guys? Involution forms are those forms, if you remember, that in Corynebacterium diphtheria, there are certain granules like metachromatic granules, polymetaphosphatic granules. So, involution forms is the last step of the bacteria, desperate step to survive. Okay, nobody wants to die. Bacteria also don't want to die. And that is what is the last phase of that. That is the involution forms. They do the last attempt to survive. So this is what is the bacterial growth curve, guys. Again, I'm telling up in a nutshell that in the lag phase, this particular phase, you remember only one word, that is adaptation. They adapt to the surroundings. And when they adapt to that liquid culture media, what is increased? There is an increase in the size. Is it fine? Then comes the log phase. And the log phase is what? Log phase is to the power n. Exponential increase in numbers are there in the log phase. And this particular log phase is maximum active and it is uniformly stained. It is maximally active and it is uniformly stained. Which one? The log phase. Is it fine? Now in this the number increase. What is not increased? Growth rate. Okay. The numbers increase, growth rate remains constant, na? To the power n, exponential increase. Then comes the stationary phase. And stationary phase, as you can see, the live is equal to dead. Why is it so? Because there is a start. Start of what? Accumulation of toxic metabolites. And there is a exhaustion of the nutrients. Okay, nutrients they start depleting up. And when they start depleting up, the bacteria starts dying. So live is equal to dead. The viable count remain constant. But it is observed that the total count, which includes dead also, that increase in the case of stationary phase. And in the stationary phase, the sporulation happens. A frequently asked question of the Viva also and in the NEET PG also. And logical it is that why the sporulation happens here. Sporulation happens because the next phase is decline phase, death phase. So that's why they start producing what? These particular spores. Okay. Exotoxin production, antibiotic production, and bacteriosin production. They all are there in the stationary phase. And I told you, remember them by this above. And then comes the final phase of the life of the bacteria, that is the decline phase, in which complete accumulation of toxic metabolites happened. And in this particular one, what is there? Like in Hindi, if you call uske paap ka ghada bhar gaya, all sins over, now have to die. But in that also, the bacteria try to have the last attempt at the life, and that attempt is termed as what? Involution forms. So this is what is the involution forms, which are seen in even conjugated diphtheria, Gardnerella vaginalis, number of other bacteria, and this is what is being done in the decline phase. So remember these particular points, 100%. One question regarding the bacterial growth curve, either in the form of MCQ, either in the form of short note, will be there in your exam. So thank you so much. Take care.